Hey, greetings, everyone. I am Craig Bielig with Ogden Regional Medical Center. I'm your host today. Thank you for joining us. We're really excited. Great program today. I've got Jennifer Gorder, and I'm going to allow her to introduce herself. And we're going to be talking about mental health and suicide prevention. This is really important, and we hope you'll stay with us and watch. Right, Jennifer?
Yes.
Absolutely. So, all right, Jennifer, let's start with who you are and your credentials and what it is you do for the behavioral health program with MountainStar.
All right. I am Jennifer Gorder. I'm a licensed clinical social worker. I am the clinical manager for the behavioral health services.
Okay. So what kind of a job is that? What do you do like on a daily basis?
So it's really quite an amazing job. I get to bridge between the patients and staff, administration. So I get to just get in there and really help advocate for people's needs and, what they need, what they want. So
yeah. Do you like working in the mental health field?
I love working in the mental health field. Yes,
Yeah.
Absolutely.
You go home fulfilled and everything, right?
I do.
Good for you.
Yeah.
Good for you. So I just mentioned the word mental health, and we're going to start off with a question that might seem super obvious, but I'm going to ask it anyway. What is mental health? Define that. I mean, is there a good way to describe what mental health is?
So mental health is pretty complicated. It's a whole bunch of things put into basically wellness. So we're looking at spiritual health, emotional health, mental health, just really looking at the different ways that we respond to the outside world, to the inside world, just really wellness. How do we interact not just with ourselves, but also with the community, with family, with people?
It's a broad topic.
It is a huge, very broad.
Like really, really big. And I think a lot of people, most people probably know this, but do you think mental health and physical health are related in any way?
I absolutely do.
Yeah.
Yeah.
Yeah. I mean, it's obvious when something goes wrong with your mental health that you might cause physical harm to yourself or something like that. But on a daily basis, if everything's going well, you still believe mental health and physical health are linked.
Yes. The body and the mind are definitely connected. So if you're not mentally well, it can show up in your body, like unexplained aches and pains, different, we call them psychosomatic symptoms. So you may have headaches because that's where your anxiety has decided to land. So yeah, absolutely.
So mental health is important in a lot of ways. Besides the things you've mentioned, why else do we have to maintain our mental health?
So mental health is important because it really is a gauge of how we interact with other people. So the way that I'm interacting with you, in order to have a relationship, in order to have a connection with someone or something, you've got to be able to want to have that connection. You've got to be able to have something within you that drives you to be connected in some way.
Okay. Is there a way to measure mental health? Can you step on a mental health scale, or can you do a saliva test for mental health or something like that? How do we know where you are mentally?
Okay, so that's a really good question. It is, again, very broad, very complex. It's very individualized. So really it's looking at where the person's at and what's kind of normal for them. So for example, someone may have a very strong spiritual mental health, like spirituality is very important to them. As long as they are engaging in that and it's kind of their normal behavior, then that would be good mental health for them. So my mental health is probably much different than your mental health.
Right.
Yeah.
Right. There are a lot of people that spend like 20 hours in a gym each day.
Yes.
But if I did that, I would be in mental health problems because that's not me. Is that correct? Is that a good way to look at it?
That's a really good way of looking at it. You had just mentioned you were at a golf tournament.
Yeah.
And I thought, there's no way I would go golfing. But then I thought, what did I do this morning? I spent an hour and a half in the yoga studio.
Sure.
So yeah, exactly. So even our mental health is much, much different.
Yeah, and everyone's an individual,
Yes.
but so here's a weird question: Is it possible to be out of balance mentally but still think you're okay?
Yes, absolutely. Yes, our brain has a way of kind of tricking us into thinking that we may be okay. And so at MountainStar at Ogden Regional, we really rely on family to help us understand and help us gather that information to understand. We call it what is the baseline? What is their normal level of functioning? Because again, their level of functioning may look very different from the next patient's. So we need other people's perceptions and opinions to help us know what is normal for them and what is, maybe their emotional mental health is what's really causing them problems.
How common is it for someone to think they're okay, but their family and coworkers to not think they're okay?
It is very, very common. Yeah, very common, because we kind of just live in our own little world. And, unless I'm telling you what's going on with me, you may not know. You may not have any idea what's going on with me.
Right, right. So when things go wrong, what are the top things that go wrong, or what are like, I guess what I'm getting at is we know that addiction is something that goes wrong with mental health in all of its forms, or maybe altered perceptions or something like that. I'm just taking a guess. You're the expert.
Yeah.
You're the expert.
Yeah, so often, people are just kind of looking for a release. They're looking for a connection. They're looking for something. So often, again, it's very individualized, but it's any kind of abnormal behavior. So it may be sleeping a lot more than they used to sleep. It may not be sleeping. It could be isolating. It could be withdrawing from family, from friends, or maybe it means that they're not having relationships with family and friends where before they did. So it can also look like eating. Maybe they're overeating or they're undereating. So energy is another big one. We talked a little bit about sleep. But yeah, anything that is abnormal or out of the normal for that person.
Right. And then, of course, there are the things that are really scary about the abnormalities: addiction, promiscuity, suicide.
Yes.
Which is one of the things we wanted to talk about today. So tell me about suicide. First off, how uncommon is suicide, or how common is suicide or suicide attempts?
Yeah, so unfortunately, I think they're a lot more common than we have knowledge of. We don't talk about it. It's something that we just don't talk about. So working in the field and seeing, on the behavioral health unit, seeing several attempts, sometimes multiple attempts from people, unfortunately also hearing of completions, it's very common, very common.
I'm sure. How do you know when someone is contemplating suicide or even thinking about it? I've heard there's warning signs. I've even read some and all that, but explain those to me.
Okay. So as we talked about mental health, we look at what's abnormal. So what's kind of different for them. So suicide is along those same lines, but it's often an exaggerated form of abnormal behavior. So often it is increased drug or alcohol use. It is sometimes giving away possessions, which can be, as a family member or a support person, you're like, oh, thank you for that. But in that patient's mind, they've decided what they're going to do. It can be talking, not just talking about feelings or a process, but talking about death. Saying, I wish I was never born. I wish that I wouldn't wake up. Hopefully I go to bed and I don't wake up tomorrow. It can also be seeking out what we call lethal means. So ways for them to end their life. So maybe purchasing a gun. It could be purchasing a rope. It could be seeking out pills. Whatever method they have decided to use, they're actively engaging in pursuing and finding.
Yeah. I had a friend, unfortunately, that had committed suicide. And this person was talking quite often about other people who had committed suicide. That we just didn't notice that as a red flag of what was going on. Is that common also?
It can be. Yeah. Again, I think every person is so individualized, but it's just that difference, that noticeable difference.
Yeah. A lot of people don't like to talk about suicide. I mean, I'm not talking about people contemplating it. I mean, it's not the kind of conversation you want to have over lunch and that sort of thing. But do you think it's important that our society talks about suicide? Or is there a risk that we might, make it sound like it's okay or something?
Yeah, that's such a good point. Most people are scared to talk about suicide because they believe that if they talk about it, they're going to put the idea in the person's head. And I promise you, you won't put the idea in the person's head because the person's already thought about it.
Right.
It is extremely difficult to talk about. I working in the behavioral health profession, I ask people this question 2 or 3 times a day. Do you feel like completing suicide? Do you feel like harming yourself? I recently had a friend who I had noticed some of those signs in, and I reached out to him, and the hardest thing I have done probably in my career was to ask someone that I cared about, are you thinking about suicide?
Really?
It was so hard.
Well,
Yeah.
how should we adults or teenagers or whatever, how should we talk about suicide? I mean, it's not like the kind of thing you bring up, hi Dave, how are you? Let's talk about suicide,
Right,
that sort
right.
of thing. But how do you talk about it? Where is it appropriate, or how do you work that into a conversation?
Yeah, so very delicate, very, very delicate. It's best one-on-one where there's not distractions.
Mhm.
It's best, in a relationship where you do have a connection where you can talk, but really it's just simply asking the question,
Mhm.
are you thinking about killing yourself?
Mhm.
Are you thinking about harming yourself? And when the person responds, whether the answer is yes or no, the biggest thing is you don't have to fix it. So if you're feeling, upset, or you're feeling like you want to do that, I don't have to fix that for you. I think that people don't talk about it because they often think, what am I going to do? If the person
Mhm.
says yes, what am I going to do?
Right.
So just remember, you don't have to fix it, and just listen. It
Mhm.
may be that the person isn't thinking about, completing suicide, but they're upset or they're sad or they're disappointed.
Mhm.
If the person is thinking about completing suicide, I would take that person to your nearest emergency room. Let a professional evaluate them, assist
Mhm.
them, get them some resources, because at the end of the day, a life is worth more
Yeah.
than being uncomfortable.
I feel embarrassed and sort of shameful to say this, but
No.
I had 3 friends in the last 3 or 4 years, men about my age, not close friends, but friends, people I knew in the community that took their lives.
Mm,
And each time it blindsided me.
yeah.
Why didn't I see this? Why didn't I see this? Is that a common thing? I mean,
It's
is it?
very common, and you probably didn't notice because we don't talk about it.
Hmm.
We just don't talk about it. That's why I'm very grateful that we're having this conversation. We're talking about, what do we look for? How do we prevent it? How do we have conversations? So a lot of times, even I am completely caught off guard sometimes when it happens.
Hmm.
We have researchers have a list of things that we can look for, and all we can do is just go with that and increase awareness. Because as we increase awareness, now I know that you'll be thinking differently if you see some of those
Yeah,
signs. I
yeah,
definitely will be thinking differently. So
yeah.
hopefully the viewers will, think differently, or maybe not be afraid to talk
Is
about it.
is there some sort of preventative medicine? I mean, should parents talk to kids about suicide just in a regular conversation? Like, God, guys, I do not want this to happen to you, and this is what I want you to do if you ever start to feel this way. I mean, is that okay, or
I think it's okay. I am
yeah,
a huge, huge fan of talking. Yeah, because when we talk about it, it's
yeah,
not a mystery. It's not a secret. I think it's, especially as we grow up and with kids, feelings, teenagers specifically, they can be so overwhelming. And even as an adult, I don't always know what to do with emotions. So talking about emotions, telling people sometimes they are overwhelming, and they're going
hmm,
to be overwhelming, but there is a solution, and the solution doesn't have to be taking your own life. So it's really about getting there when it's a smaller problem, if we can identify it, and then getting people the help that they need.
do you think that telling people that are, thinking of suicide, something like, think of what that will do to the people around you? I mean, is that an effective thing, or does that even make it worse? I mean,
So my experience is that with people that are depressed and really down, they already are in so much emotional pain. They've already got so much guilt and so much shame, that I would probably just ask the question, are you thinking about it? Do you know how you would do it? And then get them some help, because already they're emotionally overwhelmed.
mhm.
They're overloaded with emotions. So I personally would not say that. Maybe if it was before the point, or the point of them wanting to do that, it may be worth it to have a discussion. But again, there's usually so much guilt and shame about them not being able to just get better or, do harder or whatever, just to overcome their mental illness that, yeah.
What do you do as a person if you've got someone in your life that you think is leading up to this, or you're worried about? What do you do? I mean, where do you go?
So this is one of the most difficult things to do, but talk to them. Just talk to them. There's a lot of different ways to approach it. I found that the best way to do that is just to be very genuine and just express concern. So I may say, hey, Craig, I've noticed that I haven't seen you as much. Is anything going on? Or, hey, Craig, it seems like you've been down. I've noticed a difference in your mood. What's going on with you? Just really opening up that conversation and just asking them, because it could be that you're exhausted from the golf tournament.
Yeah.
I mean,
or I had a bad game. I had a really bad game that's affected me for 3 weeks.
Yeah, I mean, we don't know. And so it's really just talking to them and asking them, what's going on?
How hard is this with like teenagers? Because when you say, changes in behavior and things like that, I mean, I've had teenagers. I was once a teenager.
Yes.
I changed probably every 4 or 5 days, the way I looked and the way I behaved and all that kind of stuff. That's got to be difficult for a parent to see that.
Yeah, well, and as you mentioned, it sounds like your inconsistency was consistent.
Yeah.
Right? So you were constantly changing. You were changing clothes, changing hairs, doing different things. So we're looking at sudden changes.
Yeah.
So were you suddenly wearing the same hairstyle for 2 weeks?
Yeah.
It may be worth talking about. So it's just those sudden changes. The other thing that I think of is resiliency. So often with teenagers, anything that happens is catastrophic.
Oh, yeah. Yeah, I remember.
Yeah. I spent the weekend with my 16-year-old niece. So, yes, I gained some insight to
that
this.
was probably catastrophic to her.
Yes, that was probably I love this. Yes, it probably was. But it's looking at the resiliency and the ability to overcome that. For example, her friend wasn't able to come over for dinner. Catastrophic. She was devastated. But, within an hour or two, she started to come back to kind of her normal behavior. She started feeling better. So it's that sudden change that lasts for longer than we would think that it would. So,
well, what if the person won't talk to you? I mean, I remember, my parents, I'm a teenager, and they'd try to talk to me, and I'd be like, but seriously, what if that person will not talk to you? Or if they just sort of brush it off, like, oh, it's nothing, I just am in a bad mood today or something like that. How do you get professional help? When do you know to get professional help?
So I think as a therapist, I think it's always a good idea, if you don't know the answer to a question, if you're not sure, I think it's always a fantastic idea to reach out. For me, I would probably, if I was concerned about someone and they didn't want to talk to me, I would reach out to someone that I felt like they would want to talk to. So maybe it's a friend, maybe it's a parent, maybe it's a brother, and just say, hey, I'm feeling a little bit concerned. Have you noticed anything that's going on?
Right.
And then they can either say, yes, it is something, or no, it's not something. So, and then if you do get to the point where you're not sure and you want to get professional help, then absolutely, I definitely encourage that.
Well, this is probably a great time to give you some resources for professional help. Here is the MountainStar website right here. And right after this, we'll flash the phone number up where you can call and talk to someone if you feel like you've got someone in your life. Or, hey, if it's you, I mean, if you are watching this right now and you feel like you're maybe in danger and maybe having some mental health issues, please give us a call. Let us talk to you and see if we can help. Right?
Yeah, absolutely.
That's right.
Absolutely.
How successful is mental health treatment?
So mental health treatment, it's pretty successful. The really great thing about professional help is you have a trained, qualified therapist that gets to know you, gets to know what works for you, and they can help you set small goals and start to achieve those goals.
Yeah,
so
like you.
Yeah.
Like
yeah,
that's you,
yeah,
exactly,
That's
right?
me. That's why I do what I do. Yeah, but really just, because again, golfing for me would not be an effective goal, right? Yoga might be. So the really cool thing about MountainStar services, as well as therapy in general, is really looking at those individualized treatment plans, we call them, or goals. And, and again, because mental health is so individualized, really the person that's seeking the treatment is the one that decides how effective it is.
Well, you know what? I'm taking you golfing and you're taking me to yoga.
Perfect.
I'm going to be is it a beautiful tree or what's
yes,
that? Is that right?
The tallest tree.
The tallest tree that there is.
Yes, let's do it.
Yeah. Folks, you don't have to suffer through mental health issues by yourself. There is help available. There are a lot of resources. Here's our website again that you can get some information. If you feel like something is going wrong, call Jennifer, talk to Jennifer or one of the other people in our behavioral health staff. And I hope this has been informative for you. And I really appreciate you guys watching and more. And more, I appreciate Jennifer Gorder sharing her time, her talent, and her information with us. And she's going to turn out to be a great golfer, trust me.
And he's going to be a yogi watch.
Boy, am I ever. Am I ever. Until the next time, we'll see you later.